Really glad to. Great. Okay, do we have Barry here yet? I can't see. Here. Wait another, we'll wait another moment till Barry gets here to start us off. Oh, it says, so Kathy, Barry just sent a text saying he can't get into the meeting. Do we know why that might be?
I was going to add, a lot of people are having trouble in the county with Outlook.
Okay.
It's taking sometimes up to a half hour to get in. I had that experience.
Oh, no. Okay. Let me think here. Wonder if we could possibly text him the Zoom link. Would that work?
And maybe he could call in
Or call in
with the phone.
Yeah. Call in. Yeah, I was thinking as I drove in today, because I'm an East County resident, just the trying to have all these meetings, it's a blessing and a curse to have these meetings on Zoom. The great thing is we can just dial in, we don't have to drive. The hard thing is technology is, there's just a lot of challenges with not being able to be in the room together. And I just want to thank everybody. I think you've been doing such an awesome job of just trying to navigate this terrain and still have meaningful conversations. So thank you for that. It's been really great. Okay, Kathy's helping Barry try and figure out how to get on. A couple people still, if you wouldn't mind changing your name from SAC member to your actual name so that we can get everybody logged in on the record as being in attendance, and also so I can call on you. And we have, I'm really excited. I have to say, this is really going to be a great session. It's going to be super interesting. So thank you all. Okay, Barry's going to be on soon.
I'm here.
You're here. Wonderful.
Sorry about that. It had me as an attendee for some reason. So Kathy had to promote me to a panelist. So sorry about that, everybody. Anyway, welcome to the Stakeholder Advisory Committee meeting for October 13th, 2022. Welcome, everyone. Hope everybody's having a great day. We're going to just dive right in. I'm going to turn it over to Holly, and she's going to kind of preview our day, and we'll get going.
Great. Thanks. Okay, we are here. I'm going to talk briefly, just as some reminders for our purpose, talk about some adjustments to our timeline, and then go through what we're thinking about right now to clarify the decision-making process. And then Barry will introduce our presenters, and we're going to look at the poll results and just talk through the things that feel like they're still needing more discussion. So that's our plan. And then we will adjourn at noon. So that's the plan for today. So as a reminder of what we're doing here as a SAC, we've really had some excellent presentations from folks who've worked really hard to try and bring the relevant information to bear. We've been having a lot of interface with the IPRTF to really think about the priorities for facilities and services for our needs assessment. And ultimately, we're preparing a report that will present our recommendations to County Council that will be the foundation for the 2023 ballot. And I'm really pleased that Jennifer Moon is here. Jennifer's been working with us, just trying to compile things. She's our report writer. So she's been trying to compile things as we go so that we can be on time with our materials. Okay, next slide. All right, so here's where we came from way back in January. You guys have been such good sports. This has been a long process, but it's, yeah, really rich. We're here on October 13th. And our purpose for today is to really look at and determine levels of agreement on the priorities identified thus far. So we've got the goals, the vision, the values, the needs and recommendations that have been identified, and then needs and recommendations relative specifically to facilities. So next slide. Okay, so here's where the process is expanding a little bit. As you may recall from our last session, we have more sort of concentrated just a way of understanding how we're going to really do the public engagement to make sure that the needs assessment has had a chance for some wider vetting. So the materials that we're creating right now, we're going to start putting those out with survey in different ways, but in simplified ways through a survey that'll go out to priority audiences and to the general public. And then we're planning a town hall. So the survey and the outreach to priority audiences is being handled, as you may recall, by TVA. That's the VITA agency. And those audiences are people of color and including the tribes and folks that you all had identified early on that we need to make sure to hear from. So people who have been incarcerated in the past and their families. So these are all folks that we've hired TVA, or the county's hired TVA to go and really try and get some good information from. The town hall that'll happen on November 15th will be for all comers. So if you all want to come to that, that would be super. And if you would help invite people to that, that would be great. So Marty and I will be running that, and that'll happen on the 15th. November 17th, you may recall, is our SAC meeting number 7. So we're going to keep on refining our priorities. And then we'll have also an opportunity to look at those the first draft sections of the needs assessment that Jennifer has completed. December, now this is, yeah, Brel, I'll get to you at the end, thanks. The December meeting may actually bump into January, so you'll notice this is where the schedule gets a little bit more, loose, because we are not sure it's realistic for anybody to meet mid-December, given the holidays. But what we want to do is come back together with the SAC and really be able to look at the input that we got from the public and from priority audiences, and then also really dig into making sure that we have a solid foundation for the draft needs assessment and we're ready to present to council. Heads up, we're now thinking about not trying to present to council until February. So that was based on the last session or two of the SAC. I think we were all jointly feeling like the timeline was feeling really crunched. So there's a desire, of course, to respect your time and commitment to the process, but there's also a desire to make sure that we're not too crunched and that we all feel good about the product. So that's where we're at with the timeline. Yeah, bro, question on the timeline?
Question about the VITA outreach work. Will there be a chance for SAC members to look at what survey questions are being asked, and also maybe a chance to hear a little bit from them about how they're planning on doing outreach to some of those populations?
I think that it'll be more that you'll see the final results they'll have, you'll see the survey. The answer to that is no. The SAC's not going to review their work. They're on a track. So we've been giving them feedback to make it sure it lines up with the SAC's work. But you'll definitely see the survey. Yeah, Brooke.
What time is the town hall on the 15th?
Ooh, I thought I put that in there. I want to, Kathy, Marty, do you remember?
It's 6 to 7:30 p.m.
Okay, thank you.
Yeah, and we'll get that, the promo out to all of you as soon as we figure that out. Oops, sorry. Okay, ready? Yeah, go ahead, Peter.
Thanks for this. So on February, when in February 2023, a needs assessment presented to County Council, how late in February would that be, and would a vote be taken immediately? I'm a little concerned about this timeline being pushed so far into 2023 when a campaign needs to be mounted and have, you know, the full what would it be, 10 months or 11 months to reach all corners of this county thoroughly. So my concern.
Good question. So Barry, do you would you be able to respond to that?
Yeah, I think the thinking was the first council meeting in February. So I don't have a calendar in front of me right this second, but it would be early in February. I share your concerns. I think from a campaign standpoint, we'll be able to mount a campaign in probably 8 months, and it would be very, very robust. So we just felt that it was too important, and the timeline just wasn't working for VITA to be able to get the public input back into the kind of to the flow of information. So we felt that probably was super important to make sure we had that input. So early February, and we don't plan on pushing that at all. So
are there aspects of a campaign of this sort that could be started in January before a vote is even taken?
Yeah, but I think we shouldn't be talking about that in this meeting. It kind of veers into areas that we probably shouldn't be going into. So
Okay.
I'll get with you offline and we can talk about that.
Okay, thank you.
Yeah, I think also it's worth mentioning that one of the things that we have asked the VITA agency to do is just be part of the effort of just letting people know about the process and letting people know about the questions that are being considered. So that will also help just sort of increase the overall awareness of the conversation and the information. So that will help, I think. Kristen, did you have something you wanted to say before we move on?
Well, it's really rather unrelated, but we were just talking about when things are going to be reviewed again by us, and it made me think about our quorum number for the SAC. And since we just talked about a vote, even though it wasn't really I just wanted to bring that up, that there were only 12 as a quorum. Barry, is that on purpose or?
Yeah, we're going to talk about decision making next. So your timing on that is just perfect. And Barry, yeah, this point about quorum, actually, Marty and I were trying to do the numbers again last night. How many people would be part of a quorum? And Barry, what's your understanding? We're at 50%, 51%.
50% plus one is a quorum. So whatever that number rolls out to be with our total membership, I think Kathy's got that probably.
Well, on the website it says 12, and during our introduction together on the SAC, that's what was listed and we're told. So the official number now is 12. So
that's where we got a little confused too, because the number of SAC members has gone up.
I think that's why it was initially 12 and then nobody changed it. But I just think that it kind of just lowers how meaningful this group is if we don't have a robust quorum requirement, So.
Yeah, we'll take a look at that, Krista. You're absolutely right. And I think that's what happened is that the committee grew after that was published. So we'll update that.
Great. All right. Thanks.
Okay. Any other questions on the timeline and process before we touch more on decision making? Okay, so next slide, please. And all right, so here's how we're conceptualizing the decision-making right now. So we've been using these surveys as well as, of course, the SAC meeting discussions to help us think critically and to find common ground. Where we have areas we don't have agreement, we have areas we do, trying to navigate that terrain. What we've been thinking about is that in the final needs assessment, that we felt like it would be good to have whatever were the final survey results that we did, or we call this last one a poll, that they be included in the needs assessment appendix as a report, as in that report, to illustrate the levels of support. So even though we're going to take a vote, we really felt like we wanted to be transparent in like how much agreement is there on different things that we come to unity on or vote on. So, and going all the way back to what we had clarified at our very first meeting, we will do the formal process at either the very last meeting or potentially break it into 2 final meetings to approve the final needs and recommendations. So that'll be a motion, second, discussion, amendments, and a simple majority to pass. So again, our goal here is to really try and work towards like a consensus seeking process, though we are using a majority vote for the final decision making. So does that make sense to folks, what we're trying to do here? Yeah, questions about that? Thanks, Kendra. I always appreciate, Kendra's always giving me cues. Kendra, I really appreciate it. Okay, our process for today. So we're going to review the poll results. And we're going to discuss the items that have a less than 80% agreement. And so we've got 12 items on the poll that dip down below 80%. So what we'd like to do is figure out, what's the issues there that feel like either people don't have enough information or they really feel like they have a revision to suggest. So as we go into our process for today, we have different presenters who are going to share back the poll results. We'll focus on the areas where we have less than 80%. And then it's so helpful if we'll ask, okay, who has something to say about this one? It's super helpful if you do a couple things, and we worked on this at our last meeting. Really stay focused on the material that's in front of us. If you can be solution oriented, like here's the information I need, or here is the suggestion I have for improvement, or the things that would resolve my concern, super helpful. And also if you can keep your comments to 2 minutes or less, so we can really be focused. And I really want to make sure we try to hear from everybody who has concerns. All right, so that all voices are heard. Everybody got it? What we're aiming for? Okay, super. All right, so I think then we are on to our guidelines. I already said them. You guys have seen these before. Mostly stay on topic, avoid repeating, stay in the room, and really think about sharing the floor. Okay, we got it. So Barry, you get to introduce our presenters, and then we're off.
All right, thanks, Holly. Today we've divided up our speakers into 3 basic buckets. The first one is from the work group that worked on vision, values, and goals, and Deborah Hawley will be presenting on behalf of that work group. That work group was comprised of Deborah, Michael Lilliquist, and Kristen Hanna. Thank you for your work on that. Then Stephen Gockley, the co-chair of the Incarceration Prevention Reduction Task Force, will be talking about the needs and recommendations. And then Deputy Executive Schroeder will be going through some of the facilities and location information that we talked about on our special work session a couple weeks ago. So that's kind of what we're going to be talking about today. And without further ado, I will go ahead and call on Deborah to present the findings from the work group that was working on vision, values, and goals.
Okay, so we had 26 responses out of the 38 members. plus 4 who share seats. The percentage of response rate was 65%. So our vision statement was looking at the big picture of what we envision for our community. So we had an 88% agreement with the vision statement. Whatcom County is a model for community safety, health, and justice by reducing the need for incarceration through early intervention and long-term investments in people and programs that support prevention, rehabilitation, and accountability in the community and within the criminal legal system. So for prevention, we kind of broke that down into 3 categories, and we came up with prevention. We invest in children and families and address social, educational, economic, and racial disparities that are known risk factors for involvement with the criminal legal system and can lead to incarceration and reincarceration. Rehabilitation. We devote sufficient resources to a variety of evidence-based behavioral health, housing, and reentry support services that will minimize future interactions with the criminal legal and crisis systems and reduce crime. Accountability. To protect public safety, we utilize a range of alternatives to incarceration for low-risk offenders that require personal accountability and when incarceration is called for. We operate facilities that are humane, well-equipped, well-maintained, and adequately staffed to promote health and safety. Next slide. So for our value statements, excuse me, the core principles that guide our decision-making and investments of time and resources. Those are our value statements. Next slide. So here's the percentage of agreement with these value statements. First one, protect public health and safety. There was a 96% were in agreement with that. Prioritize timely and early interventions to save lives, improve outcomes, and save money over the long term. 92% strongly agreed. Use measurable goals and reliable data to evaluate the success of interventions and innovations and drive decision-making. 92% agreed. Facilitate public engagement and transparent decision-making processes that reflect community priorities. 92%. Next slide. Agreement with value statements continued. So openly and actively address inequities and discrimination. 88%. Honor the humanity of all parties involved in the criminal legal system. Consistently, 88%. Identify, implement, and expand evidence-based best practices, 88%. Ensure systems, services, and facilities are adaptable to changing circumstances and needs, 85%. So moving to our goal statements, which are what we hope to achieve and how we will achieve it. So here's again our percentages with agreement in these service goals here. Number 1, community and jail-based services. Example, treatment for mental health, substance use disorder, affordable supported housing. Support healing and make measurable differences in reducing crimes of poverty and repeat offenses, 96%. Low-risk offenders are safely and effectively diverted from a Whatcom County jail sentence and provided with support to help them succeed. 92% strongly agreed. Adequate funding, staffing, resources, and service capacity are available at all points of contact so that people involved in the criminal legal system are assured of a speedy and fair resolution of legal issues and have opportunities to build productive lives thereafter. Drops down a little, 88%. People released from jail have immediate access to behavioral health and medical care, housing, employment, and support systems to avoid reincarceration, 88%. People working within and alongside our criminal legal system, for example, advocates, navigators, legal counsels, jail staff, and providers are valued, fairly paid, and representative of the members of our community, 88%. Coordinated services and programs effectively close the gaps between community, legal, and jail-based services at all points of contact in the criminal legal system, 85%. Legislative and policy tools are used to safely limit and reduce the jail population, 85%. Agreement with facilities goals. Facilities are designed and operated to meet the health, safety, and welfare needs of those incarcerated and the people who work and visit there, 92%. Facilities are designed to be versatile, to adapt to changing needs, 92%. Incarceration facilities balance compassion with accountability to promote safety, health, rehabilitation, and recovery, 88%. Facilities adequately serve the whole county, including cities and tribal jurisdictions, 88%. So the poll results.
So that was all
Oh, that's it.
from that section. Beautifully presented. Thank you. Let's hear it for Deborah. Nice, lovely job. And I gotta say, Deborah, I just have to jump in and say that, we've been developing these for a while and gotten feedback from the first crack, but this group, Michael and Deborah and Kristen, they did an awesome job. Just really hashing at it and talking through the fine points to get us to this. So I just want to give one more hand to that committee, because boy, did they nail it. So good. Deborah, anything else you want to say?
No, thank you though for the accolade.
That's great. Really beautiful work. Okay, we're going to keep moving then, because we have really strong agreement on the values, the awesome vision, and the goals. And we're moving on to the needs and recommendations. So, Stephen, are you ready?
I'm ready.
Woo!
So these are the needs and recommendations poll results. We had 25 responses, so I think one fewer than for the vision, values, and goals. And that's a 63% response rate. Ideally, we'd like to have a little fuller participation in your opinions. And I think some of the IPRTF members who are also SAC members may or may not have weighed in on this. So you'll hear some encouragement later on to complete the poll if you haven't already. There are several sections here, and we'll sort of go through them one by one. Community-based behavioral health services. We have a little bit different setup here than we did in the earlier segment that Deborah summarized. Here we identify a need or a gap, and we pair it with a recommended response to that need or gap. And you'll notice that there are some differences between those, the favorability ratings of those. The first need is increase access to mental health and SUD assessments on demand, no waiting. That's very high agreement, 96%. And the recommended response to that is to support additional positions for SUD and mental health professionals with certified agencies to provide assessment on demand when people are highly motivated. We have a 92% agreement with that recommendation, so also strong. The second need and gap identified was need for additional community mental health treatment capacity, both inpatient and outpatient, and efforts to address the lack of community-based SUD treatment. 96% agreement with that too. The recommended response to that was increase availability of mental health and/or SUD treatment, prioritize admission of individuals releasing from incarceration. There, for the first time, we dipped below our sort of 80% benchmark, but just barely at 79%. So you can see there's a discrepancy between how much we agree that there's a need or a gap there and how much we agree on the recommended response to that. The next need or gap identified was increasing the capacity of effective existing programs to divert more people from incarceration, examples of which are the Lead and Grace programs and the Therapeutic courts, mental health court, and drug court. 92% agree with that need. The recommended response was to ensure stable funding to enable expansion of diversion programs that have proven to be effective in reducing incarceration. And there's a 100% unanimity that that is an appropriate recommendation we want to make. And the last need or gap in this category, I believe, is reduce response time for law enforcement involved in potential involuntary treatment act calls. So that's somebody who's presenting an imminent risk to themselves or others. And 80% of people agreed that that was a need or a gap to address. So right at the threshold of our benchmark criterion for agreement. The recommended response there was to assign dedicated, and I think here the actual term is designated crisis responder, but the professionals may have this right here. Dedicated crisis responders, DCRs, to law enforcement personnel. So co-responding to reduce response time, increase the likelihood of engagement in treatment services, and to reduce the likelihood of incarceration. And here, only 72%, still a high level of agreement, but not what we've shot for in terms of the kind of consensus or near consensus we hope to have on our recommendations. So a discrepancy there slightly between the agreement on the need and the agreement on the response. The next overall category looks at the point in the continuum for initial detention and initial court hearings. The need identified there is to devote additional resources to fully implement and then expand the use of the public safety assessment, which you will recall is the pretrial risk assessment tool, and the monitoring of people released pending trial across all courts in Whatcom County. 75% agreement there. So questions to be discussed probably there. The recommendation for responding to that need was to increase adoption of the public safety assessment in all Whatcom County courts to identify people who can safely be released to the community while awaiting trial, and to expand the capacity of the pretrial services unit to monitor people who have been released. 71% agreement there. Also probably a topic to be discussed. In the category of jail-based behavioral health services, we'd identified a need to increase access to mental health and substance use assessments on demand, no waiting. 96% agreement there. The recommendation: create positions for SUD and mental health professionals to provide Medicaid-ready assessment, what's required to admit people into Medicaid services immediately upon release when people are highly motivated. 92% agreement there. I think this mirrors the earlier community-based assessment need and response as well. The second need, evidence-based services for people with SUD who are incarcerated. 92% agreement with that need or gap. The recommended response was to utilize SUD professionals to provide available evidence-based SUD services. For example, brief counseling, psychosocial educational groups, including for methamphetamine dependence in the jail setting. 82% agreement with that recommended response. The third identified need is an insufficient number of mental health professionals and intensive case managers for the jail. 88% agreement on that need or gap. Recommended response, create positions for 2 intensive case managers working in both the jail and the community to facilitate care coordination and to support reentry staff. Agreement level there significantly lower, 71%. We'll probably talk about that as we go further on. In the category of reentry services, we identified 2 needs: increased jail and community-based reentry case management services and support, and ensure Medicaid reinstatement upon release. 83% agreement with that identified need. 2 recommendations in response to that: create additional positions for jail reentry specialists to facilitate care coordination, and specialists will also coordinate with managed care organizations. These are the private insurance entities that provide Medicaid services for immediate enrollment or reinstatement of benefits upon release. 79% agreement with that. The second identified need here was increased capacity of the Program for Assertive Community Treatment, PACT, a special formalized kind of intervention on the behavioral health side. 79% agreement with that. And the recommended response to that need was to increase PACT services dedicated to incarcerated individuals, and for an evaluation for services prior to release and immediate entry into PACT services upon release. 75% agreement with that response. And I think this may be the last category, I'm not completely sure. Post-incarceration community supports. First need was when released from jail, low-income people need access to safe housing. 92% agreement with that. The recommended response: establish dedicated housing units with case management support for reentry population who are at 30% to 80% of the area median income. Agreement level on that was only 67%, so a significant discrepancy there with the agreement on the need. Second need identified was when released from jail, people need transportation and support to re-enter the community safely. Agreement at level was 88% with that. The recommended response: a system is in place so that people released from jail can be transported directly to safe housing and/or support services. 83% agreement with that recommended response. And the third post-incarceration community support need: when released from jail, people need assistance to re-enter the workforce. Agreement there, I think maybe the lowest of our needs gaps. Agreement was 71%, still substantial. And the recommended response to that need was connect people leaving jail with vocational support services. And there the agreement was 84%. So here we have a different kind of discrepancy, much more agreement with the recommended response than with the existence of the need, I guess. So we'll try to have to parse that out amongst ourselves as well. Kathy, are there any more slides in this group? Yes. Housing services for at-risk populations. identified need for permanent supportive housing programs, both scattered site and facility-based, that need access to clinical support and on-site or improved intensive case management. That's a mouthful for a need, but 87% found agreement with that. The recommended response: increase on-site clinical support and the number of intensive case managers to support housing case managers in work with housed individuals with serious mental illness, making 24/7 clinical support available to those residents. Similar level of agreement, 87%, fairly high with the recommended response there. The second need or gap for housing services for at-risk populations was the lack of scattered site and facility-based permanent supportive housing in additional locations. 83% agreed with that need. The recommended response, twofold: increase available permanent supportive housing sites for people with serious mental illness, with focus on people releasing from jail in need of housing, and affordable housing across the income spectrum between 30% and 80% of the area median income, with units dedicated for reentry populations and with on-site supports. Again, matching 83% support there. And the last identified need or gap, dedicated housing for therapeutic court members. 73% agreement there. The recommended response: provide dedicated housing for individuals engaged in therapeutic courts as a component of involvement in the monitored wraparound services provided through their involvement with the therapeutic court programs. 68% agreement with that recommended response. Data systems to support planning and accountability. We've touched on that at various points in our discussions. The first identified need: a system for collecting consistent data from all intercept points in the criminal, legal, and behavioral health systems. 96% agreement with that need. And the response recommended was to build a data system for collecting consistent data for all intercept points. Unanimity, 100% agreement on that recommended response. The second need or gap: a data dashboard to track trends in criminal legal system, racial disparities in the system, and incarceration prevention and reduction efforts. 87% agreed with that need or gap. And the recommended response for that was to build a data dashboard to track and publicly present trends and outcomes of criminal legal system changes, efforts to address racial disparities in the system, and show incarceration prevention and reduction work. 86%, very similar agreement with that recommended response.
Great. Stephen, thank you so much. That was perfect. So what we're going to do now is we're going to go back and have an opportunity to look at the issues that were flagged as being less than 80%. What's going to be most helpful is if folks really have very specific feedback on what is needed, like is information needed, is a change needed. What I'd like to do, Kathy, is actually start from where we left off and go backwards up the slideshow. So start with the last one we were just at. Yep. So here we're good to go. Marty has marked with a lighter blue text where we've got areas for more discussion. So data systems and support planning and accountability. We're going to say check, good enough. Let's go up one. Good. So let's focus our attention then on this last one: dedicated housing for therapeutic court members, or provide dedicated housing for individuals engaged in therapeutic court. So we have both some maybe concerns either related to the need or the recommendation. So I'm going to really ask if you would stick with me, that if your comments are specific to this one, now would be the time to speak. Otherwise, I'm going to hold. So Michael, is your comment related to this?
No, but I think it's important because it relates to all of them.
Okay, go ahead.
So when you get a disagreement between the identified need and the response, it could be for one of two completely different and opposite reasons. One is you think the recommendation goes too far. The other is you think it doesn't go far enough. And I think it's really important to keep that in mind. That's all.
Great. Yeah. And it's interesting when they kind of don't line up, isn't it? So thank you very much. Yeah. Go ahead, so Paul.
I have a quick comment for all the members. That we are such a close-knit group and we've been working for almost whole year. How come we have only 25 responses out of 38? Because to start with, we are only 67%. So when we say 100% of people agreed, it really translates to only 67% people agreed. When we look at 80% people agreed, it is barely 50% of the people. I think that as a group, we should address this. Like this is a group, this is not a group of people or random people out in the community. We don't know they responded or not. I think as a group and as all of us as members of this very important function, we should address that. And address with people who, for different reasons, maybe they were not able to respond to that. But I think knowing that is important. So that's my observation. Thank you.
Thank you. So Paul, that was actually our last part of today, was to encourage people to take the poll. So I'm going to take your comment as a strong encouragement for everybody, that we do want everybody to take the poll. And also that after today's discussion, you can adjust your response. So we'll talk about that at the very end of today's session. So thank you. Good point. Yes, Scott, you're up.
All right, two comments on housing. There's two housing ones in here, but I guess.
Hold on, great, Scott, hang on one sec. Kathy, can you pop the screen back up so we can look at what Scott's going to address?
So that's coming up. My concern is with any of the housing ones, we have a housing problem in general, and why this particular group of people gets to move to the front of the bus for service, as opposed to all of the rest of the community that probably has equal or more need, but they aren't on the right bus to get services. And that's a equity question. Why this group over somebody else? And then maybe to piggyback on Michael's thing, all of them, I think all of our needs, all of our gaps, all of our recommendations are great, but I put some very low. I have a very hard time weighing cost. I mean, okay, infinite money, take care of them all, but we don't have infinite money. And somehow we need a money factor in here to say, well, to do this one is going to require, staff or whatever. And they're all great, but we can't afford them all. So I don't know how to balance the money side of this against my feelings.
Yeah, thank you. Yeah, I think that's why having things kind of ranked as priorities maybe will help with that. But yeah, thank you for that. Okay, I'm going to remind people too, the more specific you can be about what the gap is in issue or a recommendation for improvement, the more helpful it will be. So yeah, Arlene, you're up. You might still be on mute.
Yes, I think there's some truth to what was just mentioned about reasons. Another possible reasons for reluctance for people to support dedicated housing is that not everybody agrees that it's government's role to provide housing or to spend money on housing. So we have a range of opinions on that kind of thing. But I want to point out that Washington State has been and will continue to be offering more funding for housing issues, especially related to social services. So it's important to understand that that's happening. It's also possible that federal monies will be available because the current president is beginning to send funding for social services of various types.
Right. Got it. Thank you. Brel, you're up.
Yeah, just thinking about I said a little bit. And perhaps it'd be helpful in order to kind of maybe get a little bit more consensus or clarity on this. If I'm wondering if maybe someone who's like in the LEAD or GRACE program, or someone that is maybe sort of an expert on these kinds of stuff, who could maybe share some data around how stable housing has an impact on recidivism. Because if our goal is to keep people, is stable housing would be a really good investment. But I think it'd be interesting to try to find some data on that. So I guess a question that I have for the committee, or just anybody in this room, is does anybody know who might be a good person who might have some of that data that they could share with the SAC, just so we can make a more informed decision on that?
Great suggestion.
And
okay.
Yeah, just to follow up, I mean, anecdotally, like the majority of people that I know that go to jail are unhoused. So just anecdotal evidence.
Great. Thank you. Wonderful. Bill, you're up. Sheriff Elfo, you're still on mute.
Thank you. I just wanted to say I was in agreement with Mayor Korthuis. That's certainly, I think the need for services should be, or available service should be put where they're most needed.
Mhm.
I think on demand or the inference for immediate may cause issues. The question was framed as it was. And just a general statement that I hope that we still realize that despite whatever other services we need, we still have a need for a jail. And a lot of this is going to depend on internal, external funding that may or may not be available, but certainly the jail needs to be replaced. It's keeping people in those conditions are not appropriate. So thank you very much.
So noted. So I just want to note that this question about like what will it all cost and how to balance that out has now been spoken in the room. So we don't that just to know that that is here. We don't need to it'll be true of everything, right? Okay, Brill, I think you can put your hand down, and Stephen, you're up. And remember, together, I'm sorry, I just want to say we have 12 to go. So really you want to, think about that. Go ahead, Stephen.
My comment was going to be exactly on the question Brill raised. I'm going to say I don't think we need to get so deep in the weeds that we get actual data. The dedicated housing for therapeutic court members has already been developed. It's one of the accomplishments, or a part of it has already been developed as one of the accomplishments of the task force. We have clean and sober housing on Meridian Street for drug court members. The reason that came up was because extensive discussions with the judge overseeing drug court and the program manager for that said, this is a 1 year and more program. If people are required to comply with strict requirements and they go back to live in the drug-infested social networks they came out of, they don't succeed. We need a break, a clean and sober place for them to be while they go through this rigorous program. Otherwise, they fall out of drug court, they take up jail space, they recidivate. And so the cost implications of this were very clear and very critical to the success and the diversion of people with drug problems. there needs to be more. And the permanent supportive housing programs, which we did agree more strongly with, Laura Christensen, the program manager for the LEAD and the GRACE program, has also identified the instability for accessing and benefiting from social service supports for people who are unstably housed. And so we had a discussion group looking at permanent supportive housing. It's an enormously complex issue, but it is a critical factor to success in diversion programs like LEAD and GRACE. We know from the people who are working with those folks on the ground, I don't think we need more statistics. We could get them, but there's no need for them. But I think all of these are cost-effective ways to be successful in some of the other strategies we do have agreement on.
Mm-hmm. Thanks. That was really clarifying. Thank you, Stephen, for that. Okay, we have one last comment. Brooke, you're up.
Yeah, so I'm glad to hear from Stephen that there already is some dedicated housing, because I was going to say that I do think that it is a big need for people in the therapeutic courts because they're very difficult programs. And so it's very hard to be successful with all of the many requirements if you're also worried about housing. But my concern about the recommendation is that if the housing is tied to your involvement in the court, if you were to not be able to successfully go through it, then your housing might be taken away. And so it lacks some of the stability that would be necessary for people to feel safe and secure. And so that's my concern with the recommendation, is that I would like that to be addressed as part of it.
Excellent. Boy, I really am getting a sense of the breadth of perspective here. Okay, thank you. All right, let's go up one and here on the next piece. Thank you. Thank you all. That was excellent. All right, so we're on the post-incarceration community supports, and we have a 71%. Remember, we're going from the bottom to the top. So we're at 71% for when released from jail, people need assistance to re-enter the workforce. Would anyone like to speak to that? Either a need for information or a suggested change in terms of what they think is true here? Or a good guess? Okay, yeah, Scott, go ahead.
I probably rated it low. I thought this was a service we could offer in the jail and not have another outside service do it. I don't know why it couldn't be done while they're incarcerated.
Great.
And maybe I just don't know the system that well, but all right.
Yeah, great. No, that's helpful. Why, like if you think of, I know you may not remember how you responded to the survey, but if you can remember, responding to this with a less than agree, just knowing what you were thinking is helpful. Yeah, Arlene.
Yes, actually, we had an outside organization provide job training, classes, and opportunities for connecting to companies that will hire people who post-incarceration. So we did have that at one time, but it's the job issue is essential, because if you don't have a way to make a living, what are you going to do? You're going to find a way to make a living.
Yep.
And so how it's similar to the issue of housing in the sense of its significance in what we're trying to do.
Mm-hmm.
And in addition, the training that is needed to operate well in the workforce is also very, very important, because people have been out of the workforce and in a different kind of culture. And you have to learn how to be in a workplace and accept the chain of command issues and so forth when you work.
Yep. Okay. Anything else that would help this one? Yeah, Erica, please.
Thanks, Holly. I'm driving, so apologies for not having my camera on. I think I ranked this a little bit lower because given what we've heard about the jail population having significant substance use and behavioral health challenges, this feels sort of secondary to addressing those issues, especially when we're considering how we want to allocate funding in a limited pot of money. So I deprioritized it, recognizing that it's probably not the primary need for many exiting the criminal justice system.
Yeah, thank you. That's helpful. Yeah, because we've got the people who are not going to be able to enter the workforce, right? That's, yeah. Okay, anything else on this one? Because the other one, we had another one with a pretty low score, maybe one of the lowest in our whole section, and it was on the recommendation to establish dedicated housing units with case management support for reentry population that are 30 to 80% area median income. I feel like this is it may have some of the similar issues that we heard of earlier in our conversation. Anything else specific to this one? And Erica, while you've got your hand up, do you have any comments on this one? You can say no.
I lowered it, sorry. My bad.
Okay, if you do, and don't be safe on the road here. Do be safe. Okay, yeah, thanks, Brooke.
My concern with this recommendation was that, like someone said earlier, there are a lot of groups that need housing, and I don't want to encourage people to either, you know, the arresting officers or the people themselves to want to go to jail to get housing. For that to be used as a way to get people into housing, it'd be better to avoid that altogether and get them housing before that. So, I mean, definitely more housing, but making it specifically for those folks, I'm not sure is a good idea.
Yeah. Oh, this is such a tricky one. Yeah, Michael, thanks, Brooke. Michael?
I'm going to try not to repeat what was just said because it's sort of the same. If we are giving equal emphasis to prevention as well as reentry support, then yes, we shouldn't create a conflict between those two. If housing is prevention, if substance abuse is prevention, it's also there for reentry support. So you can't, I just think we can't prioritize one over the other because we've already said we want to do both equally.
Mm-hmm. Yeah, thank you. So, Paul?
I think rather than promising housing, I think we should just promise them opportunities for employment or be eligible to do that and become participants in our community. That's not we are prefacing. We are saying, okay, what else you can get for free? Just because you went to jail or just because you have certain situations, put it this way, right?
Yeah.
That should not be a qualification for getting some freebies. I think that should be a qualification. But what we should, as a society, should do is lower the stigma attached with people who have been into incarceration and or with these kind of issues and create opportunities for them. To me, investing more money in creating opportunities rather than specific things to give away would be better long-term strategy for whole community. Thank you.
Yeah, thank you. All right, Brooke, and then Eve, and then we'll move on.
Sorry, I had a reply to that comment, but when you look at the disproportionate rates of incarceration for disabled people, those people are never going to be fully employed. They're never going to be able to be employed to the level that they can afford their own housing because the amount that we pay disabled people is, you know, terribly low. So just a reply to that comment.
Thank you. Yeah, point well taken. Eve?
Thanks. Yeah, I just also wanted to reply to that comment. One of the biggest barriers to maintaining employment or even getting a job is having stable housing, and folks can't maintain a job without having a safe place to sleep, a place to take a shower, a place to do laundry, an address. A physical address is oftentimes a barrier to maintaining employment. So while offering opportunities is not a bad thing, it's also, I just think it's more important to ensure that people have housing that also keeps people out of jail. And a lot of the population that does get incarcerated are people who have fallen through the gaps, who haven't been able to access services, or people we have left behind, and they're just as important as anyone who is housed. And I think, I really believe that we need more dedicated housing, and that should be a priority before employment opportunities.
Thanks. Okay, Stephen.
I just want to clarify on this housing question that this recommendation is very similar to the earlier one on permanent supported housing. This is not just free housing that you go to jail and to get. This has intensive case management support, which is like moving back in with your parents on steroids. You've got a lot of oversight, supervision, re-guidance. This is a challenge, but it's a challenge. These people need this because they have a history of not being able to live very successfully independently. So I think the fear of choosing to go to jail for some indeterminate period that could be way longer than you think it's going to be, so that you can get housing at the other end, is not a realistic thing. I'm not sure that with the cost considerations and our focus on a ballot initiative, that this is up there near the top of our priorities. But I would like to say that I think people should understand that this is not a free giveaway to people who are jumping the line and gaming the system to get a roof over their head.
Thank you. Okay. I love that. Living with your parents on steroids. Tempting to put that in the report, but probably not. Okay, next slide. Can you open? Reentry services. Okay, let's start with this bottom one where you can see we have, and I think the comment in the survey was that people just didn't know what PACT was. Are there other concerns about this one besides a lack of understanding? Because that was the main comment, that people just didn't know what PACT was. Anything else that people had concerns about? Otherwise, we're going to keep moving and just let you know what PACT is after the meeting. Yeah, Kristen.
I just also seemed to, or felt as though it were so limiting, it was like just giving one big fix. And because because it was such a specific thing, like we have this and this will fill it, that to the exclusion of maybe some other ideas that some people may or may have not come up with, it just, I bristled a little bit at it,
Just how specific it was to this particular program.
Yeah, right. And then and then showing the faith in this and only this as a fix, kind of like not just the only fix.
Do you have another fix that you think is important?
I'm just thinking no, I don't, I mean, isn't the PAC just a big federal program? Is that right? Am I getting that? Maybe it's, but we have communities too. We could do something in our own community, and there's, even like the big ideas that the Restorative Community Coalition has. So community-based ideas, I think, deserve to be discussed. And this just felt like, and then on the other hand, I know we're trying to move things along as well, but I'm just saying that's where I got, a little stuck on this one. So for what that's worth, I just didn't know much about PAC to begin with. I had to Google it, and then I was like, oh, well, I think that there's more, maybe just more that we could have all hashed out here as a stakeholder advisory committee before we like voted on that as the solution.
Yeah, that makes sense. Great. I've got some more hands. Thank you, Kristen. That was helpful. David, go ahead. David, where'd you go? Did he just disappear?
Sorry, no, I'm here. I just I was on mute. I did the thing. So sorry, I was a little bit late, and so I don't know if this was addressed. And maybe following up on what Kristen was saying, I'm wondering. I think we're doing an increasingly good job of getting stakeholder opinions and getting voices heard. I'm wondering though, is there anybody in the SAC? Is there a group of us somehow that has our finger on the pulse of like best practices nationally or internationally on each of these questions, so that we're balancing that with like, how does housing work when people come out of jail? How does PACT work versus something else? Or is there anybody like that's super data driven and has their finger on the pulse of that stuff? I just want to make sure we're not only relying on, I think it's amazing that we're relying on our voices and the voices of our community that we don't agree with, but that, you know, just so we have a real diversity of voices. But in addition to just, most of us are coming from perspectives, but is there data, is there national data that we could also use?
Yeah.
Is that happening? I don't know if that's happening.
Well, yeah, timing's good. Perry's up next. So Perry, I don't know if you have an answer to that or additional comment, but go ahead.
Sure, thanks. Great question. PACT is an evidence-based program. I don't have research, right in front of me, but I did, and maybe you were going to go here, Holly, so forgive me, but just for that clarification that the PACT program is specifically oriented towards individuals with very serious mental illness that oftentimes cannot function without assistance. Literally, the mental illness and the challenges that they face require constant contact with the individuals that are in the PACT team for medication, for consistency, for sort of a daily contact, kind of components. So this is really identifying those really severe non-functioning individuals without that kind of support. And so just for a point of clarification that I offer that.
That's really helpful and probably something that should be clarified if we're going to include that need. Yeah, bro.
Yeah, thanks. Just following up on what Kristen's comment. I guess I'm wondering, well, I know there's been mention of sort of court navigator programs or even reentry navigator programs. And I think that's something that has been discussed, and I haven't seen that so much in these recommendations yet. And I wondering if there's if folks feel like that, like sort of reentry navigator programming would be worthwhile.
Well, let's transition to the one right above it, bro. Can you see the screen from where you are? Because I think that's what the one above it is trying to get to. And that was another one where we only had 79% agreement, which is close to 80. But can everybody take a look at that one and just see, with Brell's comment in mind here, any comment here on how to improve this or clarify it or concerns about it? Yeah, Arlene.
I think that the issue of navigators is an important one because the populations that we're talking about, and I'm generalizing now, need so much support in every aspect of this process. So yes, if we have navigators, and we are increasingly getting navigation programs, then we should also have it for the court experiences that people have. They have very great difficulty dealing with their attorneys, with decision making, having to make decisions about their own futures when they don't understand the system at all. So it would be really important to have a navigator through that process also.
Yeah, thank you. Okay, we're going to keep going just because we have so many. So point well taken, and we'll look at the language of this, and Brel maybe give some thought to that. And for Kristen too, and that idea of, are there other important things for reentry services? And I appreciate Perry like drilling us down into that's why this one is prioritized. Okay, let's pop up one slide, please. So we have this, the jail-based behavioral health services got a little bit of a lower score on the creating positions for 2 intensive case managers. Marty and I were speculating last night that it could be that the problem with this one is because it said 2 intensive managers. That might be the problem with this statement. Is that it? Is that probably what's going on here? Is there something we're missing? Yeah, Eve.
Yeah, that's why I voted lower, because I just feel like 2 is not enough. And, we're seeing across the field in social services that case managers are burnt out. And a lot of that has to do with caseloads and, to build quality relationships and rapport with clients, like having the consistency of case managers who are able to stay and work with folks through a long period of time I just think is really important. And, I don't have any data to back that up on me, but I think that would contribute to the success of folks who are engaging in the criminal legal system.
Yeah, thank you. Okay, Perry.
Sorry. Yes, actually, these are additions to, and we could certainly provide that information to the existing jail behavioral health team. That is a contract that the health department administers with Lifeline Connections. There are already 2 mental health professionals as part of this team and 1 reentry specialist. And so the recommendation really came from adding that component of reentry specialists. There's also a mental health professional that works with youth that can be, transitioned back and forth between working with adults and youth, depending on the needs. So 3 mental health professionals, 1 reentry specialist currently, and a recommendation of an additional mental health professional and 2 reentry professionals by virtue of the fact that there are a lot of individuals that are releasing from the jail and are in need of that service more than the single reentry individual can handle. So certainly speaking to the point of that's not enough, and I certainly agree. So offered that clarification.
Yeah, thanks. I think Perry's, you've got another point there that we're struggling with, which is we have more information about costs and staffing than we have in other areas. So we're going to have to figure out how to kind of rectify that. We have so much variation on that. Eve, did you have one more comment before I move on?
Yeah, just a question. I was just wondering if there were numbers on like what a caseload would look like for those case managers if you're increasing it to 3 or 4.
Okay, so let's hold that as a question of, and again, I think we've got different levels of information to work with right now, but Perry, maybe you could catch up with Eve on that offline. Let's go to the next slide, please. One up. Okay, initial detention, initial court hearings. What I'd love to hear is what is missing in these or needs to change to make these make sense for more folks. Yeah. Or if they have major problems, let's hear them. Yeah, Stephen.
I want to give some background to this because I think the comments indicated there was some lack of understanding of this. I'm information about this pretrial stuff and the public safety assessment was provided mostly as background to the SAC about existing services. This is a matter that's entirely within the scope of the judicial officers of Superior Court to support them in trying to move beyond a cash bail only kind of release system and the subjective kinds of release decisions they make. They accept this or they don't. They're not really one of our target audiences. We don't really have a say in this the way we might in speaking to the council and trying to shape a ballot initiative. So I guess I have some concern with this even being on our recommendations, because the Superior Court judicial officers, unlike the county council, haven't asked us what our views are on this. There's a lot of study in the public safety assessment. We tried to provide some of that. It's too much in the weeds, I think, for the SAC group to pivot in, but that's what I would have to say about this. I'm glad to answer other questions. I think I may be the only person working on this who's on the SAC, so I'm glad to provide more information as the group thinks might be relevant.
Okay. I think we should keep, because of those points, and it seems like a kind of a bigger issue, I feel like we should move to the next one, because we still need to do our facility stuff. So, Marty, I don't know if you just I sent you a little note here. Can you speak, you said you were able to see in the survey results where we were having maybe some needs for clarification on this one. Could you speak to that?
Yeah, it just, it seemed like the comments indicated, I'm on the one about the Involuntary Treatment Act calls, the bottom one right now. And it seemed like the comments indicated confusion about what the recommendation was saying. And I think that we do need some clarification on what it's saying, and I am not qualified to clarify, but maybe somebody else on this call is.
Good. Let's just find out who that is. Is somebody able to work on this one and clarify it? Sounds like the big problem with this one was lack of clarity. Anybody able to take that on? Arlene, can you take that on?
I'm not sure. Is it referring to the safety of the situation?
That's why I'm going to pause you there, because that's the problem. I think what we found is in these two there was confusion. So
yeah,
and I want to move us on if we possibly can. I'm guessing, Marty, I'm sorry, Perry, hold on. Was the same issue true of the one that got 79, or was that a
no? That one I feel like. The hitch was the second sentence of the recommendation: prioritize admission of individuals releasing from incarceration. And what the comments indicated is that people did not feel like any particular population should receive priority for those treatment slots. And I'm seeing some nods. So my hunch is if we took out the second sentence in that recommendation, our agreement numbers would go up. If you could give like a thumbs up if you think that, and it's not just me thinking that would fix it.
Okay.
Seeing some.
That's great.
Yeah, so I saw a sideways thumb, I think. Okay.
Okay, other comment.
We'll try that fix, and I bet Perry has something he can add to the bottom one about the crisis responders.
Perry, can I take your hands up as that you'll work on this one? Great. Okay, gang, I want to move us down then to facilities. That was excellent work. Beautiful job. Really, you guys are rocking it. We're going to go all the way down to priorities regarding jail location, and Tyler is going to lead us through this part, and then we'll squirrel around on these. Go ahead, Tyler.
Yeah, good morning, everybody. Tyler Schroeder again. Thanks for allowing me to give a background on the poll results on priorities regarding jail locations. And thank you also for the opportunity to walk through with the optional workshop that we had last week or 2 weeks ago. I think it was a very constructive dialogue about the scenarios that we walked through. So for the poll, we had 21 responses. Of the 38 members, and that's only 50% response rate. So I want to echo back to Holly's point earlier and Executive Sadhu about making sure we go back and fill the poll out for those that haven't yet today. I think the poll questions kind of came from the dialogue we had at the optional workshop. And I remember Councilmember Lilliquist kind of asking a question about how they relate to each other, what their weight is as one over the other. And so when you look at how important each criteria is in determining the location for a new jail, the first question was cost to build on site. For reference, dark green is not important, light green is less important. They're all green, aren't they? There's an important color and then a very important, which is going on the scale of teal, I guess. I'm not entirely sure. So overall, 81% said that cost to build on site was either important or very important. Adjacent space to use or purchase for future expansion if needed. In this, there was 71% indicated important or very important. Enough land to build a horizontal jail design. 57% indicated that that was important or very important, with 43% saying that that was very important, which leads about 43% recognizing that that's not important or less important. So some good background on that information.
Great.
This is a wider list of questions on proximity to other items in our community. So how important is it that the jail be located in close proximity to these resources? I think you see one of the takeaways here is the bus line. Public transportation is very important. Close to 91% of us indicated that transit in proximity to the facility, likely as some of the comments indicated, family and friends visits and release from jail is very important to all of us. The next that indicated important or very important is location proximity to the courthouse. 76% indicated that that was important or very important. And then some of the comments that discussed to be able to appear in person at hearings. And another comment indicated it'd be okay to have a courtroom in the jail or near the jail as well, wherever the jail ends up to be. The other items you guys can all see here from a public defender's office, the Crisis Stabilization Center, Sheriff's Office, Freeway Entrance, Hospital, and Work Center. There's a varying degree of importance to it. One of the takeaways that the planning group kind of had was that campus feel, the campus of a Crisis Stabilization, Sheriff's Office, and Work Center didn't show as important as what maybe had been considered earlier on. But those are kind of the takeaways from the proximity. I think the important part here is 91% said transit. 76% indicated important or very important to the courthouse and talked about the in-person hearings.
Tyler, I'm going to suggest you go all the way through and then we'll take questions.
That sounds great. So to the next slide. Additional resources and services that are important to have close to the jail. The responses were bail bond office, community-based providers like Opportunity Council and temporary supportive housing. In the comments, if transport is provided from jail to services, proximity is less important than if existing inmates or exiting inmates are required to navigate transportation services. And then another comment, should not be located close to the schools. So then this is where there was a rank preferred location question with the 3 county-owned sites that the workshop went over, be the Iron Gate facility or property, the Civic Center property down by the county courthouse, and then the Ferndale-LaBounty Road. So we had 21 answers, I believe, 21 respondents to this question. You can see that there's a first choice, second choice, and third choice. And the weighted averages of that indicated 2.52 weighted average for the Iron Gate facility, 1.86 weighted average for Civic Center, and 1.65 weighted average for Ferndale on La Bounty Road.
Fantastic. Okay, but go back up one. So what I want to acknowledge up front is that of all the polls we did, the surveys, this one we got the fewest number of respondents, and so we're really working with some limited data here to speak to. But I think it would be good for us to just spend, it's about 11:30 now, so we've got about 15 minutes to just talk through kind of what's most important for us to be thinking about, and perspectives that we want to share here to advance the conversation. Because as you can see, we still have a lot of variations on how we're thinking about this issue. So Tyler, I'm going to also ask you to help us in a moment. I'm going to take Michael's question, and then Tyler, for you to kind of help us think about what are the core issues that you feel like would be helpful for us to dig into. So yeah, Michael, go ahead.
This isn't the question, it's more information. Given the significance or the importance that people rank for a bus service, of course, there's buses downtown, but the WTA headquarters is 2 blocks, I think, 2 long blocks away from the work center site. Mm-hmm. Right now, there's some low utilized bus routes that WTA runs, and normally we'd get rid of them. I'm on the WTA board, but they're absolutely free to run, because when buses return from downtown to the operations center, they're a free route. What I'm trying to say is that operationally it'd be very easy for WTA to add bus service between downtown and the Iron Gate facility, because the buses already run between Iron Gate and the downtown facility for their own reasons to go into service. So if that's an issue, I think it's something that could be worked out with WTA as a relatively light lift.
That's really helpful, and what a nice coincidence you're on that board. But like, what are solutions? I think it's another good way for us to be thinking about these. Thank you. I think maybe we could take the screen down for a moment, the slideshow, Kathy, and then Kendra, you're up.
Hi, I'm looking at the very first slide that Tyler had. Tyler, can you put the first slide up when you showed the percentage of where, like, not that one, I have that one on picture, two more behind. And one more. Yes, thank you. For example, where it says enough land to build a horizontal jail design, the percentage is quite high for that as well, and space for future expansion, and also the cost. And then when you look at that slide, and then you go back to the slide where it says rank preferred location for the new jail, then it doesn't coincide, it doesn't make sense. And so the very first slide that you just showed, it would be more favorable for the Ferndale site, and then, but on here it's not. And then I looked at the paper that came through from our attachment for the Stakeholder Advisory Committee for the facilities work session from Thursday, September 29th meeting. And then that has all the information about all the, I don't know if you can see this, all the acreage and all the information here. And then Tyler did a really great job doing a resource about all the different things that is needed in the jail, and how when you do the math, all the calculated square footage needed would not fit anywhere on the Iron Gate or the Civic Center site. It would only fit in the Ferndale site, which is the same with slide as what you just showed, Tyler, for the first one. But then on the third slide, which was that picture right there, then it doesn't coincide with it. So I think that there might be some discrepancy with people, because I'm a numbers person, and after looking at all the information, because you guys have provided so much wonderful information, I reread that all, that it just doesn't make sense for what people are trying to figure out. So with everything that everybody has said, please look at the Ferndale site, because you're contradicting yourself. So the Ferndale site is 100% what is needed. I'm going to completely say that taxpayers would appreciate that. It's going to be less expensive. It's going to be everything. I'm going to be quiet because I could go on and on and on with what I found out. But from what I saw on this site, Tyler, thank you so much for everything you created, because it shows people are being indecisive. And it's not in a sense that that's incorrect, being contradictive to themselves. So that's my 2 cents worth. And I may be the less favorable option here, but reread everything you see and you can see that Ferndale is the best option. Thank you.
Thank you so much, Kendra. Great. Scott, you want to go ahead?
I just will add some insight into what she just said, because I've put Ferndale first, but I put Iron Gate as a very close second, provided more land is available. And there's neighboring properties, and maybe that would move Iron Gate closer to all the other things that are happening, which would make it good. But I didn't contradict myself on that one, because I did put Ferndale first. But I would agree that that Iron Gate is a good location, provided there's opportunity for more land and we acquire that land at a reasonable cost. So that was my qualifier on that one. And I would put, I still call it downtown, but the Civic location is way, way lower.
Yeah. It's interesting. Last night, Marty was saying, I wonder if ultimately we need kind of an if then, like decision tree. Like if this is true, then you go this way, if then, and we might not know all the if then. Yeah, we might not know all the ifs until time goes by, right? We may not have that, but yeah, you guys are bringing up great points. Tyler, anytime you feel ready, like you want to help us dig into specific points, just raise your hand. And otherwise, I'm going to keep going with Mary Lou.
I agree with Scott. I looked at it and I thought what I would like is the most affordable jail with the most room to expand. And that seemed to me Ferndale. So I put Ferndale first. I felt that things like bus services, if we put a jail in that site, could be added later. And I would think that taking in the overall cost of the building, which is in the millions, I don't know how many trips a prosecutor has to make from downtown out to Ferndale before the two kind of cancel each other out. But I think that's a long way in the future, especially if everybody has electric cars. So I just thought that would make the most sense to have it out there where you could expand and without buying up any more property. So thanks.
Thank you. Yeah, Peter.
I spent much last week speaking with people inside the criminal justice system here locally, and my takeaway was that there was a willingness to be outside the Civic Center, away from the courthouse, as satellite offices and courts could be constructed at Iron Gate. And it would be great if anybody inside that system wanted to speak to that. Also, I am very much in favor of Iron Gate over Ferndale. And the reason, there are several reasons, but only if there is enough space there to build a horizontal and facility and get all the things that we need there. And I'm going, no, I thank you. I hear that, but I believe that there may be space there that we're not considering that could be purchased to make it all happen. So those are my thoughts. Thank you.
Great. Thanks, Peter. Michael?
Yeah, I think, again, there's some dynamic aspects here that need to be considered. So, for example, if Iron Gate or the down Civic location was selected, then the Ferndale property is surplusable. It kind of works another way, though. If any site other than the Civic Center is chosen, then we will need a presence near the courthouse. How big is that presence? And how big might it grow to be? So, for example, if the jail was moved out to Iron Gate, does the work center really best continue to be used as a work center? Or might that building, which was never well designed for its current purpose, be better to be repurposed for something more like admin, office, treatment spaces, other things? and that the needs met by the work center might then go down to the civic center where they might be more compatible. There's dynamism there. If you really need space at Iron Gate, you can get it. All you have to do is find a new home for the work center, and you're going to have another half block of empty space or unused space back at the civic center. So there's some dynamism here. Keep in mind that pieces will move around. And so it's not, you shouldn't just decide based on current locations, current functions, current assignments, but what the new configuration could look like. Keeping in mind, there'll need to be something somewhere near the courthouse. What is it?
Thank you. Great. Tyler?
Yeah, I just want to recognize, and I'll just build off of Councilmember Lilliquist's comment there, because we've gone through all of those different iterations, because it is dynamic, and it will be as it moves forward to the complexities of site evaluation and site selection for these essential public facilities, as we're talking about. And the last iteration definitely did have courthouse improvements to allow for better transport for individuals that need to be in the courthouse for their hearings, to be in person. So those remodel efforts were anticipated and likely would be anticipated again if it was an offsite location, meaning there would be transport for individuals to then get into the courthouse up to the court that they needed to be on the third, fourth, fifth floor. And so that would be anticipated if there was a site that was selected by the county council in the future that wasn't a civic center location. And I guess the only other thought that I've had is that 81% indicated the cost to build on the site was an important criteria in determining location. That met that 80% threshold that we've kind of been talking about.
Yeah.
And so maybe trying to provide more information to the stakeholder advisory committee of the cost estimates between horizontal and vertical. You know, and I did some research in the last week well, longer than that, but more thorough research in the last week or two in regards to it. And there's actually some information back from 2008 and 2010 that we did specifically in this community on that question. The report really indicated the substantial increase in cost for a vertical facility, the pretty equal cost in operations. But maybe that would be something that would be helpful to coalesce and send out to the stakeholder advisory committees for their review. It won't be current at this time. It's not current to the conversation we're having. It's a 2008, 2010, but you'll see it is pretty much the exact same question that we're considering. It was done by HDR back at that time. So maybe a piece of information that would be helpful.
That sounds great. Yeah, thank you, Tyler. Okay, so I see Stephen and Kristen, and then I'd love to hear from people who haven't yet had a chance to speak today on the call. So Stephen, go ahead.
Thanks. I'm probably going to be an outlier here, but I want to talk about the Civic Center site because I think there are a lot of design factors that we have no information on. Even if we had information on, we wouldn't have the capability of assessing them. What I remember from Tyler's presentation was we had 1.3 acres in the south parking lot. We had another 1.3 in the pit on the other side of the courthouse. And then we have the footprint of the existing jail, which could be admin, treatment, leveled and rebuilt there. So I think there's a fair amount of land there. And I don't know whether we could replace parking with underground parking or rooftop parking. I don't know what those comparative costs between horizontal versus vertical. I don't think we have anywhere near the information that we need to make informed recommendations here. My recollection is that a lot of the Ferndale property was not developable. There were wetlands mitigation issues there. I can't see migrating a lot of things to another site out of Civic Center. We're not going to move the courthouse. And so there are so many moving parts, and so many of them are sort of ill-defined and ill-quantified. I found it very difficult to choose, but I think there's so much value in maintaining the core of services and the cluster of services in the Civic Center that I would encourage us to take I would encourage us not to make a choice, because I don't think we can. I think that's a design phase that's after the community input that we're providing. Certainly we can provide feedback on needs and recommendations, but I'm not sure location is something that we're very well equipped at the present time or in our membership to provide any meaningful input on.
Mm-hmm. Well, and maybe I feel like we're getting some really good input on how to think about or what the considerations are. It may be that at the end of the day, we're not going to say, aha, here's our perfect solution.
The other point I forgot to add, Holly, if I may just jump back in. Stark mentioned before the possibility of eminent domain. I'll recall that the library has not wanted to be there, has not thought that was a capable spot. So there's a whole block of land that might potentially be developable downstream. So there are a lot of floating possibilities, I think, that we haven't taken account of.
Great, thank you. Okay, Kristen, you're up.
One way I was looking at the Civic Center location would be maybe to have that be a triage type of an intake and a place for, to house people when they're going to court, having enough room. If you're transporting them in from an outlying facility into this main hub where they started, it's kind of a classification. If you hub, and then, because like Mr. Lillquist was saying, we're going to need something there at the court, near the courthouse, unless you take the courthouses to the jail, which is kind of less favorable. It's less public, kind of, but I'm thinking that just have a well-coordinated triage center downtown, and then maybe try it. The point being to divert as many people out of it before they actually go to court. So they have their, maybe this 48 hours where they could be charged with something or fully diverted. I mean, the cost of diverting somebody before the whole drug court journey is immense. That you can prevent this whole big expensive drug court experience to begin with, perhaps, not every time, but the fewer people we let through the door into this whole court system, the better. And maybe have that be the big goal of this little of our main jail that is in the Civic Center. It's just one thought. I mean, I'm trying to think, do we really want to fit everything together anyways? There's just so many possibilities. And I also really changed my mind about the Civic Center location. I favored it so much last time. After hearing Stark talk about the other locations. So there are just so many possibilities here. I don't think we should be nailing something down right away.
Yeah, thank you for that. I really appreciate too, Kristen, just your trying to think outside the box, thinking creatively about solutions, and also allowing, I can be influenced, my thinking can be influenced. That's sort of the purpose here. So we're going to have just a few more minutes. So people, David, I'm going to have you speak, and then anybody who has not yet had a chance to speak today, I'd love to hear from you. So David, go ahead.
I guess I know that in Whatcom County, we like to reinvent lots of wheels. And that said, I think I'm going to echo a little bit what Stephen Gockley was saying. And I think this group as a stakeholder advisory committee, as stakeholders, is probably a great data source. But then I think I think there's people, I mean, I personally feel very ignorant to answer any of these questions as an individual or even as a stakeholder. I feel like analysis and recommendation based on the data that we collect is probably much better done by experts in that, who again have their finger on the pulse of like externalities that happen in other places in the country and the world when decisions like this are made. I would love us to maybe focus on getting information from lots of diverse stakeholders and asking people with the expertise to do the analysis for us, because none of us are going to be here when these buildings are like, hopefully, I mean, you know, we're hopefully building this for the next 100 years and not 10, 20, 30. So just, I guess I'm saying if my voice would say, let's do our best at collecting data and offer the analysis to an expert in that.
Thank you. Okay. So who else feels a need or a desire to speak now to add to this conversation? We've got, I'm just looking at people who haven't spoken. So Maya and Dan and Cara, Eli, Arby. Great, go ahead.
It just seems to me that the focus on a site selection at this point is really putting the cart before the horse. I think what we've talked about is that the horizontal facility is the way to go. And think about just for a minute, what would a vertical facility look like downtown? It would be one of the tallest buildings downtown. You know, and I don't know if that's, or in the downtown core area, I don't know if that's the image or impression we want to give to the community, where we have this big jail and justice center right in that area. Whatcom County is a big county. There's a lot of space. And so I think getting more information on settling on what the building's going to be, what the facility itself will be, then the site comes later. The other thing I wanted to mention too, and I think I mentioned this before, just a bit off topic, which is I think, you know, focusing on doing this next year in next year's election is risky. It's failed twice. The referendums have failed twice when we brought these in off years. And if you look at what the voter turnout is in those years, it's half of what it is in a presidential election cycle. And so I think there really needs to be, well, and I understand the importance and the urgency of this, but this is a long-term process, which is why I don't think, you know, stuffing us into sites that aren't perfect until we know what it's going to be and until we know what is the right time to bring this to the voters. Let's not have strike three. You know, we want to get it right this time. We want to make sure it gets passed.
Yeah, thank you. Dan?
Yeah, so I was in favor of Civic Center for quite some time, and I no longer am, based on just a variety of factors, many of which have been mentioned here today, so I'm not going to repeat them. I think Iron Gate's our best option. Ferndale location failed twice at the ballot box in 2015 and 2017. So I don't think that's a winning combination. And I think the things that Councilmember Lilliquist brought up in terms of transportation, bringing the court, and then the other members bringing the courts to Iron Gate. There's also the Crisis Stabilization Center that's located at that location as well. I think that's not been brought up. And my only other question or I guess concern is that in listening to the conversation today, I feel like there's an extensive amount of project creep. Some of the items that we've talked about they're embedded in other ballot measures that have already passed. That the drug court housing, as Stephen brought up, exists. There's clean and sober housing in addition to that. So I think we need to focus a little bit more on what are we recommending to the council. I mean, to me, it's like facility and services, but the whole, and I'm a ardent housing fan and got the record to prove it. I just don't think that should live in this particular ballot measure. I think it needs to be more narrow, and I feel like we've just gotten away from that. So I'll just contain my comments to that. Thanks.
Thanks, man. Okay, Teresa, I saw you turned your camera on. Did you want to chime in?
I do. I just wanted to actually say thank you to Kendra because I too feel like I can be swayed. I initially chose Iron Gate because to me it makes sense, but I personally feel a very strong sense of urgency. Our jail is awful. It is a horrible, horrible place. I mean, I have been in there. I've seen what those women have to endure, and it's nasty. I mean, oh my God. I would not want to go there for anything. It is not safe. It is not a healthy place. And it's horrible. I mean, not that jail should be wonderful, but it's terrible conditions.
Yeah.
And I just think we have to do something. I mean, at this point, it's like the place is falling down. And I'm just not thinking that our community really sees how serious the problem is.
Yeah.
I think it's being just very sugar coated. And I think if they really saw the true picture of what that jail is on the inside, that maybe they would see the sense of urgency that should be there.
Yeah, thank you. Oh, really excellent discussion. I'm going to move us to our closing. So if you have further comments that you feel like you didn't get to speak to today, or they come, you think of something afterwards, you can email those to the webpage. Any feedback? Yeah, sorry, it's that send feedback is that last second bullet down. So I just want to say that I really appreciate, especially that, this kind of broader sense of what information do we have? What do we not have? What's realistic and appropriate for the needs assessment, and kind of the timing of things and the sense of urgency counterbalanced with the sort of political climate or timing of things. I really appreciate us just thinking out, about that. And again, that people are being influenceable, and it's really terrific. So here's what we've got for next steps. We've got the 2 polls. So it would be wonderful. And I want to just echo what has been said by Paul, that it would help so much if everybody fills these out. So by October 19th, if you haven't yet filled it out, or you can go back and redo it. So Marty and I can see who's done it, and we can dump your old poll and put your new poll, have your new poll stand. So if you want to change your answers, you can. If everybody could please fill out those 2 polls by October 19th, that'd be great. And that'll just help us keep thinking, and do add in comments. I did it's not me, but all of us, mostly Jennifer, we've got that table of contents for the needs assessment. If you could take a look at that and give any comments, that would also be helpful to when you see that piece. We've got the upcoming meetings. So the November 15th is the town hall. Again, if you can spread the word, that'd be terrific. And if you can attend, that would also be fabulous. We'll do that as a hybrid meeting as well. And then our next meeting is on the 17th. So make sure you've got that on your calendar. We're going to keep on diving in here. There was some good feedback too today about kind of what's inside the box and outside the box. So we'll need to give that some thought. And then if you, wow, for those of you who, above and beyond making sure they're catching up, even if they can't make the meetings, thank you so much for just really digging in here. Really super appreciate that. And so that's where we're at. And we're going to hear, it's going to be exciting to see what we learn from TVA and hear what kind of information they dig up. So we don't want to do any formal votes on anything until we hear back from these other audiences and make sure we have that full picture. So that's our aim, is to really make sure we're thinking, with a better sense of all the voices here, or at least what we can get in the time we have. So that's what we've got for today. I'm going to close this out again. If you have comments, I'm going to turn it over to Barry. So thank you for the last couple of folks. And Barry, you ready to close us out?
Yeah, thanks, Holly. Scott, we'll just go ahead and let you do a final comment and then we'll adjourn. Go ahead, Scott.
This is so important to all of us. And I think at the beginning that we're going to skip December. I, for one, am more than willing to find 2 or 4 hours in December to have meetings in December to move this up a month from February to January. So, I just think, yeah, if we can meet in December, I'll be there. Zoom from anywhere in the world, I'll be there.
Well, we'll kick that around because we've kind of talked about 2 different timelines and one included something in December. So we'll definitely keep that into consideration, Scott. Thank you.
Yeah.
All right, everybody. Thanks again for being here and spending a couple hours with us. And we appreciate all the hard work that you put into this so far, and appreciate going forward on the results that we can provide to the council. So again, we'll see you at our next event, November 15th, hopefully. And again, that will be hybrid, so the folks will be able to attend by Zoom should they not be able to go in person. So anyway, have a great day, everybody. We are adjourned.